Hi, my name is Sakshi Shrestha and I'm currently a third year bachelor nursing student and I'm due to graduate in December 2026, and I'm very interested in applying for Canberra Health Services graduate nursing program as I'm passionate about developing my clinical skills and growing into a safe and confident registered nurse. In this video, I will address the selection criteria and reflect on how my clinical placements have prepared me to deliver safe and person-centered care. Firstly, in relation to scope of practice, I recognize something is outside my scope when I've not been appropriately trained, accessed as competent, or authorized to perform any kind of delegate task. I follow the NNBA standards and always prioritize patient safety. If I'm unsure about doing anything, I seek guidance from my preceptors and supervising registered nurse. For example, during my placement, when I encountered unfamiliar procedure or medication errors, I escalated appropriately and ensured supervision, because I understand that asking for help is also a professional responsibility and essential for patient safety care. Secondly, regarding medication safety, I follow the 10 rights of medication administration, check for allergies, and ensure correct patient identification using 3 identification. I also minimize distraction and follow organizational policies and guidelines. And also, if any kind of medication error occurs, my first priority would be to access the patient immediately and inform the supervising nurse and escalate the problem as soon as possible. After that, I would document the incident and complete an incident report form and reflect on situation to prevent it from the future errors or further errors. Because I value transparency, patient safety, and open disclosure. So, in terms of prioritizing patient or workload, I would firstly access the patient number B who is experiencing chest pain, appears pale, and is diaphoretic, because as this indicates potential deterioration, which requires urgent assessment. Nextly, I would assess patient number A to avoid maintaining dignity and preventing falls, either by attending myself or delegating appropriately. I would then assess patient C's nauseas, monitor observation, and provide appropriate care. And lastly, I would coordinate to patient D's non-urgent CT scan while communicating any delays. Throughout my whole shift, I would continuously reassess priorities of the patient, communicate with the team, communicate with the multidisciplinary team, and ensure safe and efficient patient care. In my practice, I incorporate the NSQHS standards by delivering safe patient care, maintaining infection control, ensuring patient or patient identification, accurate documentation. I also apply work health safety principles through safe manual handling, correct PPE use, and also maintaining safe environment. Finally, giving an example of communication during my clinical placement is when I cared for a patient who was anxious about the procedure. I used active listening, communicated clearly, and provided reassurance. I also escalated concerns and collaborated with a multidisciplinary team like doctors and physiotherapists. As a result, the patient felt more calm, supported, and informed, which also reflected my commitment to respect, compassion, collaboration, and patient-centered care. Thank you for considering my application. I'm highly motivated to continue learning and developing as a future registered nurse, and I would love and value the opportunity to contribute to Canberra Health Services as a part of a graduate program. Thank you.